There we go.
Okay. Hello, everybody. My group and I will be presenting on alcohol addiction and family therapy techniques. We'll begin with background and significance of alcohol addiction. So, alcohol use disorder is described as a medical condition characterized by an impaired ability to stop or control alcohol use despite adverse social, occupational, or health consequences. In the next few slides, I'll talk about risk factors, which are genetic, environmental, and psychological. I'll also talk about the effects on body, liver disease, brain function, mental health, and more. And we will also discuss, especially later in the presentation, treatment and recovery, treatment access, treatment methods, and recovery. Oh, oops. So risk factors for alcohol abuse, addiction, and alcoholism. Genetics and family history play a huge role in alcoholism. AUD is about 50% heritable. Those with a family history are at significantly higher risk due to shared genes and environment. It also affects mental health. Conditions like depression, anxiety, PTSD, and ADHD often co-occur with alcohol misuse, increasing the risk of addiction. Early drinking, which, some people start using alcohol before the age of 15, which greatly raises the risk of developing dependency compared to starting at 21 or older. Inability to stop. Individuals find it hard to quit Remeron, which is a pill that is given to people with alcohol use disorder, especially if it commingles with depression. Social and cultural norms. Cultures that normalize earlier heavy drinking have higher rates of alcohol abuse due to relaxed attitudes and access. And there's environmental and peer pressure. Living around heavy drinkers or having peers who drink increases the likelihood of alcohol use, especially during adolescence. How alcohol affects the body. As we can see here, alcohol greatly affects the body. It affects the brain, the liver, your heart, stomach, pancreas, digestive system, reproductive system, nerves, immune system, and musculoskeletal system. You can get headaches, which are common with alcohol use. Long-term use, such as long-term use causes damage, such as stroke and dementia. You can also have fatty liver, alcoholic hepatitis, fibrosis, and cirrhosis can develop in heavy drinkers. Heavy drinking can cause inflammation and pancreatitis. Alcohol-induced irritation in the gut leads to diarrhea and vomiting. Alcohol can cause neuropathy and permanent nerve damage. Metabolic syndrome can develop in heavy drinkers, which causes high blood pressure, elevated blood sugar, and excess fat. Existing anxiety and depression tend to be worse with alcohol, especially since it is a depressant. Chronic heavy drinking is linked to heart disease. Gastritis and peptic ulcers are caused by alcohol-induced inflammation and sores. For men, alcohol decreases sperm count and quality. In women, the risk of miscarriage and preterm births are higher. Excessive drinking causes muscle cramps and increases the risk of osteoporosis and gout. And drinking impacts the body's ability to recover from an illness. Now we'll be focusing on statistics and prevalence related to the addiction and its impact on families. So, from a 2024 study, about 27.9 million people ages 12 and up met diagnostic criteria for AUD in the past year. 16.7 were males and 11.2 were females. The CDC estimates that there are about 178,000 people that die per year from excessive alcohol use in the United States. A 2023 study estimated that 19 million US children, which is about 1 in 4, live with at least one parent or primary caregiver who has a substance use disorder. Alcohol use disorder was the most common parental SUD, affecting about 12 million children. More continued statistics. Ages 12 to 17, there's an estimated 775,000 children who met the criteria for AUD. Adults 18 and over, there was about 27.1 million who had AUD in the past year. Impact on families, according to the stress strain coping support framework. It affects family functioning. There are psychological and physical health effects. There's severe impact on children, reciprocal relationship between partners who drink, and intimate partner violence is also big between people who drink. Why this topic is significant in the field of MFT. Alcohol use disorder is a chronic disorder which leads to psychological, behavioral, and health consequences for the drinker, including impaired functioning in relationships and daily life. It is a systemic issue which affects all parts of family functioning. There is a reciprocal relationship between family dynamics and alcohol use. Children are at a higher risk for behavioral, emotional, and academic problems. Next.
So let's explore the impact of alcoholism on family dynamics. Next. So let's look at this from a family systems point of view. Alcoholism and chronic stress affect the entire family. And if you think about it from a systems view, it's not just linear, it is a reciprocal relationship where the alcohol use and the family stress create more of each other. It'll disrupt the family emotional, financial, and interpersonal stability. It's easy to understand why. And then the alcohol affects the family functioning, which increases family dysfunction, which increases the alcohol. So all of these effects within the system serve to reinforce the drinking. And stress is shared with everybody in the system, not just the alcoholic. So whether it's parents, whether it's the children, whether it's siblings, any other family that happens to live in the house. If you think of Beautiful Boy, the substance use reverberated there within the chef family, even though Nick wasn't even living at home. So alcoholism reverberates throughout everything. So families will reorganize around the addiction, achieve a new homeostasis, and then family life centers on the addicted member. Conflict avoidance becomes a survival strategy. It's easier to not have a conflict, to keep the peace than to solve the problem. However, that reinforces the drinking. So the non-using family, they'll start to take on different roles to keep that homeostasis, and we'll explore that in the next slide. And then alcoholism actually can serve a function. It could help maintain emotional distance. It could deflect from a conflict. It could be marital strife, but the alcoholism serves to relieve some of that stress. Unfortunately, coping becomes a dysfunction. The denial of the drinking, it decreases immediate anxiety, but it increases secrecy, which increases the anxiety in the system, which creates more stress, which creates more drinking. Control breeds resentment and rebellion, not any actual limitation of the alcohol. Even emotional cutoff is a coping strategy that'll lead to isolation and more emotional distance. Then communication diminishes between family members and emotional availability decreases, as McGill indicates in the 2015 paper. And on the next slide, we'll see how what that looks like.
Oh, it's stuck. Oh, okay.
So the family system that's reorganized around the alcoholism and the alcoholic, you may be familiar with a lot of the different roles in the family. Enabler is probably one of the most well known, but there's also the hero, the scapegoat, the mascot, the lost child. The mascot, for instance, is the person who tries to keep things light amid all the chaos. And what each role does, it helps to protect the system from collapse under all this immense stress that the alcoholism and its consequences have upon everybody. What that sort of does is that each of these roles helps make the chaos at least more normalized and as predictable as it can be and familiar. Um, and so in all these different roles, they end up becoming rigid and inauthentic. which again leads to less emotional communication, less real addressing of the stressors, which increases the alcoholism. So you can see again and again and again how the system seeks to reinforce the problem. So what happens is that shame and secrecy dominate. The family, they focus on managing the alcoholic rather than actually being a family. Shame will prevent people from actually really talking. Shielding from the pain of the alcoholism or its effects will become more important than speaking any truth about what is happening. So then coping becomes reactive rather than relational. All the responses are driven by anxiety. All focus on the symptom, which is drinking, and none of the underlying causes and conditions. And blame and control become prioritized throughout the family, which again, reciprocal. Next slide, please. So the communication and the emotional climate in the family, the conversations stop being about family life and they start revolving around control, blame, or crisis. And often the dialogue becomes this cyclical process of accusation, defensiveness, retreat, more accusation, more drinking, and attempts to fix the problem actually escalate the tension rather than reduce it. And eventually, emotional honesty will feel dangerous because it's not going to get addressed. When that happens, the empathy and the safety in the family decrease, reactivity increases, and family members become sort of walking on eggshells. They anticipate problems, they anticipate attack or criticism. Um, the emotional safety throughout the family erodes. So everybody is defensive, and I kind of call it being in a war posture. They're always expecting conflict or difficulty rather than expecting intimacy and comfort. And in those situations, a small trigger will produce outsized reactions. So a small event can induce rage. Um, then you have this system where anxiety and stressors fuel everything. They fuel secrecy, they fuel withdrawal, they fuel distance, and members decide it's better to hide their emotions so that they can prevent conflict. The secrets reinforce the mistrust, they reinforce the isolation, reinforce the secrets, and so eventually the family's emotional bandwidth narrows to just survival mode. How can we get through each day dealing with this alcoholism in the system? And none of the strategies in that case will actually help solve the problem. Next slide. So finally, and we'll address how to get through recovery from a family systems view in the slides ahead, but in a family where the alcoholic is recovering and the family system is being addressed, the whole system will reorganize and find a new homeostasis without alcoholism at its center. The old roles, the hero, the enabler, the mascot, they're not going to work with this newly sober family member. And failure to readjust will more likely lead to relapse because you're not adjusting the system, and the alcoholic can't fit in the new space without a lot of further damage happening. Um, so ideally, the secrecy and blame, all these cycles, they get replaced with trust and openness, but this requires a family systems and family therapy in order to get to this place. Members will learn to express hurt without hostility. Accountability will become a shared value, not a weapon. Um, Hopefully, communication stops being punishing, it stops being an accusation, defense, um, uh, retreat, and becomes compassionate. And then emotional honesty will help foster a deeper connection rather than further isolation. So that kind of looks like this equation of family resilience being one part adaptability, a part connection, and a part new boundaries. Like it is really healthy to reorganize the system and to have a resilient family, you work together. So, but that does require like a reset of roles and responsibilities throughout the system. It could be subsystems, it could be within the husband-wife or wife-wife, whatever that may be. It could be parent-child, but those all have to be reset. But it's important to note that relapse in this case does not have to mean going back to the old homeostasis. It doesn't mean resetting to previous roles or systems if it's planned ahead and as part of the family therapy and the post-recovery planning. So that's a look at family systems, and now we'll go on to see how that works with treatment.
Okay, we can go to the next slide.
This one.
You can go to the next one. Yeah. Okay. Cool. So, my colleague Miguel really, helped with showing us how this affects the family system because you cannot think of treatment intervention without looking at alcohol use systemically. It doesn't Substance use never emerges in isolation, and it is shaped by the systems people live in, including family, culture, developmental experiences. And families can either buffer or amplify that risk. And when we invite the family into treatment, outcomes improve for the person drinking and for the whole household. In session, a therapist would start by mapping the system and the function of alcohol use, and then we set shared goals. Treatment focuses on replacing the function that alcohol has been serving and strengthening communication, building daily structures that support sobriety. Safety and cultural context are addressed up front, including, screening for intimate partner violence, clarifying privacy and consent, tailoring plans to family values and treasures. That is why the systemic models like behavioral couples therapy, alcohol behavioral couple therapy, and family behavioral therapy and multidimensional family therapy, which we'll talk about in the upcoming slides, they target the patterns that keep the behavior going, not just the behavior itself. So we can move to the next slide. Because alcohol use functions as a coping strategy within the system, each of these evidence-based family models work by changing the system itself, not just the use of alcohol. So in behaviorals couple therapy and alcohol behaviorals couple therapy, partners create recovery contracts and daily check-ins, reframing sobriety as the shared responsibility between the two of them. And these practices lower relapse rates and they strengthen couple trust. In family behavior therapy, it expands this focus to the whole family, addressing stressors like finances, parenting, or conflict. There's restructuring of daily routines and reinforcement patterns, and this leads to lasting behavioral change. In multidimensional family therapy, this goes deeper, even deeper into the context behind use. It uses system mapping and genograms to explore how cultural and developmental forces shape alcohol use. It helps families see drinking not as the problem, but as a signal of the system's pain points. So, all three of these approaches demonstrate that when connection and accountability replace isolation and shame, recovery becomes sustainable and relational. And then we're going to move on to the interventions in the next slide within these models. Um, these interventions take abstract systemic theory and make it concrete. Recovery contracts and trust discussions create structure. Families replace secrecy and surveillance with openness and shared accountability amongst each other. Communication and problem solving work gives couples and families the language to express hurt, repair after conflict, and reestablish trust. Relapse prevention planning is another systemic piece. It anticipates crisis as a family event, not just as an individual's relapse. Everyone knows their role within this, and it reduces reactivity and shame. Boundary setting and contingency management protect both the person in recovery and their loved ones, distinguishing support from enabling behaviors. And then finally, system mapping and psychoeducation help families see how generational trauma, cultural scripts, and developmental wounds shape the function of alcohol use. These are not just techniques, they are ways of rebalancing the family system toward connection, structure, and safety overall. And let's go to the next slide. The family, as we've, spoken about up until this point, it's not just a part of the problem or background variable. It's one of the strongest predictors of change. When families participate actively, treatment engagement and completion rates go up and relapse rates go down. This happens because the family system provides daily reinforcement of the new behaviors being learned in therapy. Coping styles really matter here, like families who respond with empathy and consistency rather than confrontation tend to more support sustained abstinence. The community reinforcement and family training model, or CRAFT, better known as CRAFT, illustrates this well. It teaches relatives to communicate effectively, rewards sober behavior, and reduce enabling, all while improving their own mental health and boundaries. When families stop being labeled as codependent and start being understood as collaborators in systemic repair, the work becomes relationally driven. And the therapist's task here is to shift from fixing an individual to facilitating new, overall healthier patterns across the entire family. And that just further, feedback loop of this overall healthier dynamic. And on our next to last slide, we're going to see how I wanted to speak to some of the systemic barriers that come up when wanting to use family inclusive alcohol treatment. I wanted to separate what happens inside the therapy from the larger systems around the family. I want to name these structural forces that make it hard to even offer these models. First, most treatment and financing structures are designed around the individual identified patient. Family sessions are often seen as extra rather than essential. And if a rehabilitation program isn't set up to bill or schedule family work, it doesn't happen, even when therapists know it might be best practice. So families also face stigma in this process. They are sometimes viewed as enablers or as the root cause of the addiction, which can create shame and keep them from participating, even though evidence shows that they can be key agents of change in this process. There's also the financial barrier. Many family inclusive interventions are difficult to sustain because there's no consistent reimbursement path. So programs default to individual care because it's the only thing they can bill for. So when we talk about intervention and treatment strategies from a marriage and family perspective, we also have to talk about advocacy for policy and program reform that allows models like behavioral couples therapy, multidimensional family therapy, and community reinforcement and family training craft to actually be implemented where families get to show up. And to close on my last slide, recovery is not just about the removing of the alcohol, it's about rebuilding connection. When the system around the person changes, when communication, emotional safety, and boundaries improve, recovery outcomes strengthen, and families begin to heal together. So addiction often functions as a way the system tries to regulate distress. If we only treat the individual, we miss the relational and cultural dynamics that keep it alive. So family-centered care builds connection, safety, empowerment, the antidotes to shame and isolation. And to make that the norm, not the exception, we have to keep pushing for systemic reform that embeds family involvement at every phase of treatment. As a future marriage and family therapist, that means that we're not just clinicians, we're systemic advocates helping families and programs move from fixing individuals to restoring the health of the entire relational system. In short, when families heal together, recovery becomes possible for everyone involved. With that, I'll hand it over to my colleague Connor to explore how these ideas show up in practice and the barriers that still need addressing, targeting change or reorganization within the family.
Thank you for that introduction. So challenges and barriers in treating addiction within a family context. Challenges and barriers to alcohol or drug addiction, and family therapy techniques come in different forms. Um, One of the initial challenges or barriers that stood out to me is boundary setting. Boundary setting is a common challenge. Supportive families must understand how they can be supportive without enabling the addict or alcoholic. So, to me, it's understanding that the family is showing up for whoever the addict or alcoholic may be within the family context, but there's this nature of wanting to be so supportive, and in doing so, you end up enabling the behaviors and making it easier for the continued pattern of behaviors to persist. And um, we'll get to actually, some of the strategies to overcome this, but on the other side of that, it's boundary setting in a way where the family can understand where their position ends and where they draw the line and how they can show up for their family member without overstepping. Um, Another barrier is effective communication. So first off, it's addicts and alcoholics and the struggle with honesty. One of uh, the nature of addiction and how it shows up for the individual, there is a lot of lying, cheating, stealing, and defensiveness, all these ways of responding to the world around them, and communication within the family becomes extremely difficult when there's a lack of transparency. So, additionally, communication of expectations and confirmation of understanding the position of all parties involved is important in family therapy. So, while expectations are being communicated in terms of um, expectations and potential consequences, what the boundaries look like, all aspects of the therapeutic process, making sure that's understood by the addict or alcoholic is extremely important, because there is that natural tendency to squirm and become defensive, or just get out of that position of uncomfortability by um, making it seem as though there's this lack of understanding. So really communicating where everyone's coming from a is a barrier in family therapy. Next slide. So more challenges and barriers continued. Um, Relapse prevention and safety planning, creating comprehensible consequences, plans of action for relapse. And, when I mentioned safety planning here, it's the act of having a plan in place if relapse were to occur. Um, so creating an unwavering response for the family as they respond to addicts' behavior rather than react in the moment. So, um, planning ahead of time, essentially, as to how the family is going to respond to certain behaviors rather than just reacting in the moment, but having this plan of action that is, here is how we are going to go about this as a collective unit, as a family, if relapse were to occur. Um, yeah, we can go to the next slide. So the strategies to overcome challenges and barriers in family therapy. Well, it strategies may differ depending on the modality of therapist, such as Bohemian using the multi-generational transmission process to identify substance abuse patterns through interventions such as genograms. So genograms are great because they lay out kind of the predisposition that the addict or alcoholic has given the family history of substance abuse. Um, there is the boundary setting strategies, as I kind of touched on before, but it's behavioral contracting to define behaviors to support sobriety with specific observable behaviors and consequences for relapse. Um, the effective family communication through psychoeducation, skills training, having family sessions both with and without the addict and alcoholic. Um, this can be extremely beneficial as it allows the clinician to speak to the family in a way where if they're not familiar with addiction, it lays out what it typically looks like and how to maintain those boundaries, how to effectively communicate, how to manage day-to-day life in a way where they're not enabling or overstepping those boundaries and actually making the addict or alcoholic feel as though they're trapped. Because that can conversely really affect the family dynamics because when they feel trapped, they tend to lash out and go the complete opposite way. Um, yeah. So in continuing the strategies to overcome these challenges and barriers in family therapy, effectively communicating expectations, seeking a shared understanding of behavior patterns moving forward. That's getting the entire family on board with a plan of action. And that's kind of like the behavioral contracts that I'd spoken about before. Um, this can look like homework assignments and creating implementation that can be reflected upon during follow-up sessions to track progress and gather insights as to where improvements can be made and where further interventions are required. Um, yeah, so in adding on to this, the in relapse prevention and safety planning, they come in as strategies to plan ahead. These relapse response plans and safety agreements, but creating contracts, verbal or written, and just furthering accountability within the family dynamic. Um, as well as identifying coping skills and to expand upon that plan. It's just meaning that if relapse or a break in contract were to occur, the response of each individual is pre-planned as an immediate action. That's minimizing the impulsivity of the family as a collective and trying to rid of this reactive communication or reactive um, response that could further, I guess, blow up the situation into something that becomes even larger than it needs to be. Um, but that's what I got for that. So. Yeah, it's kind of just talked about this a little bit, but that relapse prevention and safety planning are strategies to plan ahead through relapse response plans and safety agreements, the creation of contracts, and then, yeah, identifying coping skills and creating a plan. So, um, planning ahead is a major part of uh, family therapy when it comes to addiction, because it's difficult to deal with on the spot. And so knowing what the plan of action is, it's how things need to be laid out. But um, yeah, that's all I got.
These are our references. Thank you for listening.